So a concussion is essentially this acceleration and this deceleration injury that happens to the brain. And look, the brain is essentially the consistency of jelly, right? It's full of these communicating cells called neurons. And maybe we can conceptualize it like this. Imagine there's a bowl full of spaghetti, that's your brain. And if you can imagine it accelerating and then decelerating quickly, it's going to compress and stretch and jiggle around a bit. And when that's happening, all of these neurons, they're becoming stretched, sheared, and there's this disruption that happens. And when it becomes disrupted like that, we get this essentially this electrical storm. All these neurons become activated. And depending on which part of the brain is getting injured, you might have concussion. About 10% of people have a concussion. Will fall unconscious. You might have ringing in your ear. You might see stars. If you see stars, it's literally these neurons in the brain sending off this little electrical impulse, which is what you're seeing. And yeah, it might take a couple of minutes and you might suddenly feel okay. But just because you feel okay doesn't mean you are okay. The next stage will happen a couple of hours later. So the brain will try and compensate for all of this electrical energy and this discharge, and then you'll become fatigued. The symptoms will come back. You might have a headache. So I guess we really need to be cognizant of the fact that it's not just this physical injury. It's actually, if you look at it under a CT or an MRI, you won't see anything, but it's really causing this kind of microscopic changes in the brain and the way the brain functions.
Leela, what's the middle ground there between not getting involved at all and then the other end of the spectrum of putting yourself at the worst risk?
I think it really comes down to being guided by the science. See, I don't think people realise that the average concussion takes about 30 days to recover. So you might stop having symptoms after 10 to 15 days, but your brain is still recovering in that time. So you can imagine, if you've broken your arm, you put on your cast, you don't take your cast off after you start healing and you feel better. The bone's still recovering, but we don't have that same kind of visual side with the brain in concussion. So in this case, if we have this knowledge that if you have a second concussion when you're still in that 30-day recovery period, it's additive. So it's going to have quite drastic effects on the way your brain behaves and you have your potential for recovery.
We talk about this in terms of the month, the 6 weeks immediately. Do we have a sense of what the long-term implications are from concussion and also, I guess, on behaviour, mental health as well?
Yeah, so, the science on this is very far from being settled, but we do know that people who have repeated head knocks, so people who are in contact sports, boxing, even combat in the military, you have this increased predisposition to having chronic traumatic encephalopathy or CTE. And this is associated with all sorts of mental health changes, depression, suicide, changes in thinking, changes in memory. And yeah, at this point, as I said, the science isn't settled, but it's this clear association between these sort of head impacts and this pathology that's happening in the brain.